and this video of the series is probably one of the most important because this breathing is really going to make a difference in every aspect of how you exercise and every aspect of how your pelvic floor heals. So pelvic floor breathing is something that you can use to both prepare for birth if you are pregnant right now. If you are already postpartum, this is a great way for you to strengthen your pelvic floor, tone your pelvic floor, and just like rebalance it. And a great tool to use also when you are going to lift things postpartum. So many uses, and you will understand once I explain this. So the kind of pelvic floor breathing that we are going to learn today is called connection breath, and it is my absolute favorite to teach because again, it is so versatile. Now, what connection breath is essentially is breathing through your diaphragm, relaxing your pelvic floor, and breathing out and contracting your pelvic floor. So if you are pregnant, especially if you are towards the later months of your pregnancy, it's really important that you are focusing more on the relaxing of your pelvic floor rather than the contracting, because relaxing your pelvic floor is going to help you tons during your birth. So if you have that type of control over your pelvic floor, then you will be able to relax it more in birth. If you are postpartum, learning to contract your pelvic floor, that's going to be great for strengthening and toning. Okay, so what I want you to do first is lay on the floor. Now, as you lay on the ground, you're going to place one hand on your diaphragm, then one hand on your pelvis. And you're going to use your hands to feel your belly rising and falling as you breathe. Okay, so go ahead and lay on the floor. And then when you're laying down, I want your knees up so you can really focus on that feeling and it forces your back down to the floor. And you're going to place one hand on your diaphragm and then on your pelvis, like I said before. When you breathe in, you're going to fill your diaphragm and belly with air. You should feel your diaphragm and belly rise. And then when you breathe out, you should feel your belly and your diaphragm lower. Okay, I'm going to sit up and explain this because I think you're going to be able to hear me better. So place your hands where they're supposed to be. When you breathe in, you're going to fill your diaphragm and your pelvic floor with air. So you should feel that rise in your belly. And then when you breathe out, you're going to feel your belly empty, lowering down. You're going to pull up and in your pelvic. Okay, so you should really feel the difference between your belly and your diaphragm rising on the breath in and falling down on the breath out. Now, when you're doing this, I want you to think about your pelvic floor being like an elevator. Okay, so as you're breathing in, your elevator is dropping all the way down to the bottom floor. It's relaxing down there. When you are breathing out, your elevator is rising all the way up to the top floor. Now, another way of thinking about this is picturing your vagina pulling a tissue out of the tissue box as you pull your pelvic floor up and in. And I think that vision is like kind of weird, but it's actually really helpful envisioning your pelvic floor drawing in. Now, you can practice this in a few different positions. The best way to learn how to do connection breath is laying down on your back like we were before. You can also do this sitting on a firm bench. Now, when you sit on a firm bench, you again got to make sure it's firm so you can feel your sit bones underneath you, and that's just going to set you up to doing this breath correctly. You can also do this while standing, and that's going to help you form correct posture as well. And that's a really good one to do as a postpartum mommy. And you can also do connection breath, and I actually really recommend this, is doing it while you are exercising. If you are cleared to exercise and you are at that period of time where you are ready for it, then as you begin exercising, connection breath is a really good technique to implement because it's going to cause your core and your pelvic floor to connect and in return strengthen both of them, which is our main focus in exercising as a postpartum mom. And when you're pregnant, definitely still incorporate this as well, but again, your main point is practicing that relaxation of your pelvic floor. Lastly, for my mommies who are very newly postpartum, you can start connection breath at any time. This is not something that you have to wait for 4 to 6 weeks to start. This is something you can start implementing slowly within the first week that your baby's born if you are feeling comfortable with it and if it's not causing you pain. And just start slowly. You can start by doing 5 of them. Okay, let's recap a little bit. When you are doing your pelvic floor breathing connection breath, you're going to place your hands on your diaphragm and your pelvis. You're going to breathe in. You're going to relax your pelvic floor as your belly rises. You're going to breathe out. Your belly and your diaphragm is going to fall down, and you're going to pull up and in your pelvic floor. And that's it. If you guys have any questions, then ask them in the discussion.